Question 1. A 34-year-old woman with no prior transfusion history receives a unit of packed red blood cells. Within minutes, she develops urticaria, pruritus, and shortness of breath. Which of the following is the most likely mechanism of her reaction? A. Antibody-mediated destruction of donor RBC antigens. B. Host IgE reaction to plasma proteins in donor blood. C. Cytotoxic T-cell response against donor HLA antigens. D. Deposition of immune complexes in pulmonary capillaries. E. Formation of donor anti-host antibodies targeting WBCs. Answer B. Host IgE reaction to plasma proteins in donor blood. Explanation: this is a type 1 hypersensitivity reaction mediated by IgE antibodies directed against donor plasma proteins, commonly IgA. Preformed IgE on mast cells leads to rapid degranulation, releasing histamine and causing symptoms like urticaria, pruritus, wheezing, and hypotension. A is incorrect. This describes hemolytic transfusion reactions, type 2. C is incorrect. This refers to graft versus host disease, not common in transfusions. D is incorrect. That describes a type 3 reaction. E is incorrect. There's no donor antibody targeting host WBCs in this case. Question 2. A patient with known selective IgA deficiency is scheduled to receive a transfusion. To avoid a severe transfusion reaction, which of the following precautions should be taken? A. Administer antihistamines before transfusion. B. Transfuse washed red blood cells lacking leukocytes. C. Use leukoreduced and irradiated blood products. D. Provide IgA-deficient plasma and blood products. E. Delay transfusion and check for hemolysis markers. D. Provide IgA-deficient plasma and blood products. Explanation: IgA-deficient individuals may have anti-IgA antibodies, which can trigger anaphylaxis when exposed to IgA-containing plasma proteins. The safest strategy is to use IgA-deficient products. A is incorrect. Antihistamines may help with mild allergic reactions, but won't prevent anaphylaxis. B is incorrect. Washing removes plasma, but this doesn't guarantee IgA-free product. C is incorrect. Used to prevent GVHD and febrile reactions, not IgA issues. E is incorrect. Delay isn't the preventive IgA-deficient products are. Question 3. Which of the following clinical features is least likely to be associated with an anaphylactic transfusion reaction? A. Hypotension. B. Fever and chills. C. Respiratory distress. D. Urticaria and pruritus. E. Shock. Answer B. Fever and chills. Fever and chills are more commonly associated with febrile non-hemolytic transfusion reactions or acute hemolytic reactions. Anaphylaxis manifests rapidly with hypotension, bronchospasm, and skin symptoms. A, C, D, E are all classic signs of anaphylaxis. Question 4. A patient begins to experience hypotension, respiratory arrest, and wheezing 15 minutes into a transfusion. What is the most immediate next step in management? A. Administer acetaminophen. B. Stop transfusion and give IV epinephrine. C. Administer diphenhydramine and continue transfusion slowly. D. Draw blood cultures and start antibiotics. E. Give furosemide to treat suspected TACO. Answer B. Stop transfusion and give IV epinephrine. Explanation: this is an anaphylactic transfusion reaction, and the immediate life-saving intervention is epinephrine. The transfusion must be stopped immediately. A is incorrect. Acetaminophen is used for febrile reactions. C is incorrect. Do not continue transfusion in suspected anaphylaxis. D is incorrect. Sepsis may cause shock, but this is a classic allergic reaction. E is incorrect. TACO, transfusion-associated circulatory overload, presents with hypertension and pulmonary edema, not wheezing, hypotension. Question 5. Which of the following best explains the rapid onset of symptoms in an allergic transfusion reaction? A. Complement-mediated destruction of donor RBCs. B. Delayed activation of cytotoxic lymphocytes. C. Preformed IgE-mediated degranulation of mast cells. D. Formation of immune complexes that deposit in vessels. E. Activation of macrophages by alloantigen exposure. Answer C. Preformed IgE-mediated degranulation of mast cells. Explanation: in type 1 hypersensitivity, preformed IgE antibodies bound to mast cells cross-link with the antigen, e.g. donor plasma proteins, leading to immediate degranulation and release of histamine and cytokines. This explains the minutes to hours timeline. A. D. Seen in type 2-3 reactions. B. CD8 plus T-cell mediated cytotoxicity is delayed, type 4. E. Macrophage activation is more relevant in inflammatory or infectious reactions. Would you like similar questions for other